like a disease, it starts spreading. Now it shift the eyesight. I say, I don't know why. Some will worry about the next man's stride. Try to match up a next man's life. Fix your life. And as soon as I start walking on, you want to vex, something must be wrong, you man. I don't come here for that, all you help me. But I'm not telling you. I'm telling you nothing they do will never defeat me. Because control me your destiny. I'm telling you. Take your hand and point it up in the ceiling for me, please. I'm telling you, rule number one, we don't come to beg nothing from them. I'm telling you, stop the people, music, look, everybody chanting. I'm telling you, counting people, business, while we counting the blessings. I'm telling you, counteraction time, so help me broadcast the message. No bad vibes on my side. We fuel by motivation. Keep sending out good signals. Pay attention to your audience. Let your light shine. What's for you will be for you. With the real ones rooting for you. Just let your energy introduce. You can say I don't know why. So we'll worry about that next man's stride. Try to match up a next man's life. Fix your life. And as soon as I start walking on, you want to make something must be wrong, you man. I don't come here for that. All you help me. But I don't see how I'm telling you. I'm telling you nothing they do will never defeat me. Control me your destiny. I'm telling you. Take your hand and point it up in the ceiling for me, please. I'm telling you, rule number one, we don't come to beg nothing from them. I'm telling you, stop the people, music, look, everybody chanting. I'm telling you, counting people, business, while we counting we blessings. I'm telling you, counteraction time, so help me broadcast the message. I tell you, we are still pumping. Yes,
Good morning to all of our listening audience. You're listening to Hard Talk Grenada. It is a beautiful sunny morning in the Spice Isle. Of course, we want to say a special good morning to those of you joining us on 97.5 City Sound FM, 89.5 CRFM, 92.9 Sister Isle Radio, and that's broadcasting from Hillsborough, Carriacou, and 94.9 We Noise Radio coming out of Brooklyn, New York. It's always a pleasure to be here with you. And as we said yesterday, today we're going to continue the conversation of NHI. And that's simply because healthcare is the topic of the day. It is what's happening right now. It's on everybody's plate. It's on the tip of everybody's tongue, and it is the concern. So we want to bring to you as much facts as possible, as much information as we can, as we get it. So I definitely want to encourage you to call your friend, call your neighbor, turn your radios up and listen to what we're saying and the conversation that we're having today. But before we get into that, there are a few housekeeping matters, of course, that I want to attend to. And of course, our guest is already in studio, so let me deal with my housekeeping matters and then I'll get straight to him. The St. Mark NNP Fundraising Women's Group invites you to their monthly breakfast sale, and that's happening on Saturday, the 9th of November, 2019, and the time is at 6 a.m. They're going to be in front of the Victoria Anglican Church, and they have a wide range of things on sale. Bakes, fried bakes, coconut bakes, fried breadfruit, fish cake, Tanya log, cocoa tea, and so much more. So you want to pass and support that. Of course, we have as well the Springs Group. They're saying that they're having a breakfast on Saturday morning, and that's near the Pan House next to the playing field. And all proceeds from that fundraiser will be to assist with a Christmas tree lighting in the area. We know it's that time and it is that season where everybody's getting together to see what they can do for the children during that time. So if you have any, of course, from any of the constituencies, any fundraising activities and so on that you want to you want us to announce, where you don't be afraid to send us a message and we'll be happy to do that for you. Now we're going to go straight into it. We have with us this morning, of course, Mr. Stan Phillip again, who, of course, as I mentioned yesterday, has a wealth of knowledge as it relates to the National Health Insurance. So we're going to kick the conversation off with him. He's going to say hello in a while. Before we do that, we want to introduce to you a new aspect of the program that we hope to implement, or we hope to achieve something great out of this. I always advocate for people airing their views and their concerns and their opinions, and being part of processes and sharing, your ideas and so on. And we wanna first state that this new aspect, it's an opportunity for you to share your ideas and your suggestions. Now, it's an avenue where you can do that may very well help make a difference. And that's what we aim to do, to make a difference. We don't want to just be empty vessels making a lot of noise, but we want to share our opinions on relevant topics, on things that can help develop Grenada, So the question for today is, in your opinion, what do you think can be done by all persons involved, all stakeholders in the healthcare system to improve the delivery of healthcare in Grenada? And I'm going to say that again. In your opinion, what do you think can be done by all persons involved in the healthcare system to improve the delivery of healthcare in Grenada? So you're going to have an opportunity to answer those questions. You can send your answers via WhatsApp at 440-7377, or you can join us live on Facebook, HARDTALK Grenada, and you can post your answers in the comment box. Hopefully we'll get some time allotted today, because we have a lot of conversation to have about the NHI, but hopefully we'll get an opportunity later down in the program where we can, speak a little bit more about that, and give some people an opportunity to go ahead and answer that question. All right? But Mr. Stan Phillip, please. Let's say hello to the people. Good morning.
To our listeners. It's always a pleasure and an opportunity to share with the listening public information that's absolutely necessary, so that they can understand what's on the way.
Yeah.
For Grenada. Yeah.
Absolutely. I agree. Yesterday we had an extensive conversation. I mean, we went a little not off topic, but we went a little away from the line of topic of conversation that we were having, just to speak about a little bit about all of the things that we all as Grenadians know and have experienced about the healthcare system. And I mean, some people felt that we were coming down or bashing the nurses, but we must say that is never our intention here at HARDTALK. We never intend to bash. Our intention is always to provide facts and to clarify as much as we can. And of course, if there are any nurses out there that feel like they have been bashed, or that feel that we were a little hard on them, of course we apologize, as we did yesterday as well. But it's important for us to be honest with ourselves, and to be honest as Grenadians, that there are problems with our healthcare system. We know what the problems are. We can identify the problems, and the problems don't only lie on the side of the Ministry of Health or with the government or things like that. There's a wide array of things that need to be addressed in order for the healthcare system to be effective, and we have to understand that, and we have to be honest with ourselves and stop playing politics with a lot of things that really do affect the Grenadian public. We seem to, in Grenada, politicize everything, and we must try to come away from that and actually see it from the point of view of average Grenadian people, because they are the ones that are affected by whatever policies and whatever strategies that are put in place to help manage the healthcare system, to improve it and to improve its efficiency. So I'm just going to repeat the question one more time for the people who are just joining us. Remember, you can go on our live page, put your answers there, or you can send us a WhatsApp at 440-7377 of your opinions and your ideas that may very well make a difference, right, in the policies. It may just spark an idea or spark a conversation that can help to improve the efficiency of the healthcare sector. So the question again is, in your opinion, what do you think can be done by all persons involved in the healthcare system to improve the delivery of healthcare to Grenada? And we want to ask that you keep your answers relevant to the question. We have a tendency to read to respond and not read to understand.
Yeah.
So keep it relevant to the question at hand. So, Mr. Stanphilip, let's get into the conversation that everybody's itching to listen to. It's the national health insurance and the benefits. Now, the conversation of the basket of services.
Yeah.
I believe that's what we're going to be talking about today.
Right.
What does these basket of services entail? What is the basket of services? You know, a lot of people ask this question because a lot of people still don't understand what is meant by the basket of services. Does it mean that only if I can only afford a little bit, I get a little bit? Does it mean that if I can afford a lot, does the basket of service open up to me based on my salary or what I can contribute? Or, let's talk about that.
Yeah, under any national health insurance program, especially one that's about to be launched, the designers would identify what is commonly called a basket of services, a benefit package, that members of the program would be entitled to access. I should say from the outset, though, it has been recommended, and WHO, PAHO, all of those organizations have warned countries that are attempting to go into NHI to be very careful in the introduction of the benefit package. Their advice is that it's better to be incremental, start small and then add as you grow, because it makes no sense offering everything or opening it up to say, once you're sick, just come and we'll take care of you.
Right.
So the recommendation is that you identify a basket of services. So that's why it's called a basket. It's contained.
Right.
And you can build on that as the program grows. So the designers of the National Health Insurance Program, and in this case, the University of the West Indies, is the organization that the government engaged to advise on the basket of services. Prior to that, the National Health Insurance Advisory Committee identified some services. And so that was the base that was used.
Right.
But UE did the in-depth study,
Right.
and made some suggestions as to what they think should be included in the basket of services, at least for initial launch of the NHI.
Okay.
Right? Now, in general terms, these services includes primary healthcare visits, specialist visits,
Right.
hospital care, and hospital care would include both inpatient and outpatient care services,
Right.
investigative services, oral health services, emergency care and service, home health care, and that one is important, home health care, visits, acute psychological care, rehabilitation services, and personal prevention services. Now, that is being general.
Right.
Right? Now, we can break that down. Under primary health care, we're looking at areas like taking care of infectious diseases,
Right.
mental health, and mental health is key.
Of
I mean,
course.
if you follow, there's a lot of conversation on this mental health issue.
Yeah.
In the past, it was swept under the carpet. Now we recognize that we are living with this thing
Right.
daily, so it had to be included. Nutrition and dietetics, and that again, we have to be able to advise people on the way they should take care of themselves. What should they eat?
Right.
Because you want to prevent them from getting sick. Oral health, and my good friend Dr. Dubois is a dental surgeon, And she always says that the mouth is like the gateway to your body.
Yeah.
You know, and if we take care of the oral issue, a number of things that happen to us won't happen. So oral health is there. Pediatrics, of course, we have to take care of children.
Right.
Maternal and child health, that's also included there. Gynecology, ENT, ears, nose, and throat. That's part of it. Asthma, sickle cell, chronic diseases, nephrology, home visits, traditional or supplemental medicines. And this was included because it was recognized that the regular medicine is often complemented with the traditional medicine. I mean, I remember when I was growing up, my mother would send me to get bush. I mean, I've forgotten all of them. But, I mean, I knew what they were. So she would say, go and get whatever the name is. Right? And I go, I bring it, and it's boiled. We used to use that before. Now, the thing is, there was no measurement. I mean, you dry it and you drink it, right? But that it's recognized that traditional medicine has a part to play in mental health, in NHI. In fact, one of the things that we discussed when we were looking at the benefit package is at what stage will we incorporate those types of medicines. So if somebody has a preference to go to a herbalist, would that be covered? So all of these things have to be recognized. And of course, there's emergency, right? Burns, falls, injuries, etc. So all of those things would be part of the benefit package. And then there's the investigative services, right? Ultrasound, Doppler. In fact, I came down with an illness, and I had to do a Doppler.
Yeah.
And that's the first time I heard about it. You know.
Yeah,
But
I've had one
you've
done.
had Doppler
Yeah,
done,
because
right.
I've had and that was actually because I was unaware, and you see sometimes that's why these things are so important because I was unaware at all that of how easy it is to get a blood clot, how easy it is, and the Doppler was recommended just to find the location so that they can help, and it's very much a costly
exactly.
It's a very costly
right. So
procedure.
that is included under radiology, X-ray services, mammograph, CAT scans, MRI. All of those things are investigative services. Then there's biopsies. That would be part of it. Invasive diagnostics. That is also part of it. And colonoscopy.
Right.
So these are investigative services that will be covered. Then there, of course, all the labs that's done, that will be part of it. And then the pharmaceuticals.
Right.
And here we have, Grenada have what is called a national drug formulary. That's a group of drugs that's generally is accessed through the OECS. All the OECS countries buy from one supplier.
Right.
So that pharmaceuticals would be covered. I am positive that whatever amount that's been ordered now, the range would be expanded because you're now catering for a wider range of illnesses.
Right.
Then vision and oral health services would be part of it. As far as vision is concerned, we're talking about eye examination, lenses, frames. Of course, not expensive frames like yours, but workable frames, right?
Workable frames.
And then oral health services will include extractions and fillings for both children and adults, as well as cleaning. Then there is the inpatient services. We're talking about things like surgical, right? General surgery, maxillofacial, neurosurgery, orthopedic, and nose and throat, pediatrics, internal medicine, obstetrics and gynecology, oncology, anesthesiology, ophthalmology, psychiatry. All of those things would be covered under the benefit package.
Wow.
So it's very comprehensive, and that's why I said yesterday, the aim is to include everything that's available on island to begin with. Right. One of the big questions that's asked is, would this benefit package include overseas care? I'm one of those persons who, usually sit back and look and say, so unfortunate that people have to be going around with a sheet, asking for donations or having a motorcade to raise monies to take care of persons who are ill. In many of those cases, the care is not available on island.
Right.
And we keep discussing how practical it is to offer overseas care.
Mm-hmm.
And the warnings have always been, if you venture there, you're looking at sizable sums of money. So the strategy basically is to look at non-traditional places that offer high-value care at reasonable prices.
Right.
So that's the strategy that is being looked at. So in the event that overseas care would be included in the benefit package, and the leaning is towards at least having some of those included. We have already done some forward looking work. We know the Cuba issue. Cuba has opened up to us, and there is a quota that we are allowed to send to Cuba at a fixed price.
Right.
I had the opportunity to visit Colombia, and the mission was intended for us to look to see what's available there, to see if we can have cooperation agreements, to ensure that in the event that we want to broaden the coverage for overseas care, we have an alternative.
Mm-hmm.
And on the 2 occasions I went there, I discovered that the persons who are looking to Colombia are not only people from the Caribbean.
Right.
There are a number of persons coming from the United States going to Colombia because of the quality of service they offer.
Right.
And that's why yesterday I said that when we have our network of providers, the persons who are part of the program would know the areas or the places they would go or they would be allowed to go under NHI.
Right.
So for example, as I said yesterday, if somebody needs a coronary bypass, that person may want to go to the United States, but the approved provider for that service under NHI may be Colombia.
Right.
Or some other, maybe Cuba. So that's what you'll be told.
Yeah.
That's where we're going to be sending you. And again, this is not a case where you just get up tomorrow and say, well, I want to go. You have to be referred.
Of
right?
course.
So we have looked and we have negotiated. We have spoken to a number of those hospitals. In fact, in my visit, I think I visited about 15 hospitals in about 6 different states in Colombia. We also went to Cayman to look at the Cayman Health Services. That's a group of Indians that set up a hospital in Cayman. Right? So there are places in and around the Caribbean that can assist us, even when we decide to go to the overseas care part of it.
Right.
So there's an active discussion regarding the inclusion of overseas care in the benefit package. Because if the services are not available on island, then it has to be accessed off island.
Yeah.
The thing is, where can we get it?
Yeah.
Very good quality and at a reasonable price. So that's why we looked at that. So in essence, that's what the benefit package is. I mean, it's a mouthful, but it generally covers almost everything that one would want to have as far as health interventions are concerned. And because you're looking at 3 levels of care, there's primary care, which is available on island. Right? We have some aspects of secondary care on island also, but some of it will have to be accessed off island. And there's tertiary care, right? That's generally is offered off island. Right? So that's basically what the benefit package speaks to.
But it's good to know this information because when we talk about the basket of services, I think people get the impression that it is multiple baskets with different services that will be available to different types of or classes of people, and that's not the case. It is a basket of service, a basket of services that encompasses everything that is available in our primary healthcare system to Grenadians on a whole. Of course, we know that healthcare in Grenada is not at a level where everything can be done on island, and that is why we have some instances where persons have to travel to receive certain types of healthcare and things like that. And in some cases, when people travel, it's not necessarily because we don't have it on island. Sometimes it's a personal choice, a personal preference. But and of course it's their right to do that. But the basket of services, as you said, comprises of a wide range of different services. And I love the fact that we are now incorporating traditional medicine into that mix, because a lot of people believe in traditional medicine. I mean, if I have a cold, I prefer to drink a lemongrass than a multi-symptom, you know. So a lot of people believe in traditional medicine, and it works. It works. And the question of the quantity is a very, very, very important conversation, because there are a lot of people that are of the belief that me, I'm going to mix some lemongrass with some moringa or some, you know, some what is a bitter fence, and they mix in all kind of thing, and we do not know what effect these things have on our body, because it's medicine, whether it's traditional medicine or you go in the pharmacy and you pick up a couple of pills, it's still medicine, and they still do have effects on our body. So I'm glad that conversation has started as to how we can incorporate traditional medicine into our primary health care and also deal with the issue of quantity.
Yeah, the thing is, with traditional medicine, one of the things that NHI would ensure is that any provider or every provider is certified.
Right.
So I cannot wake up tomorrow morning and declare that I am a traditional medicine specialist.
Right.
And have people coming to me to get prescriptions filled.
Yes.
It has the person or persons have to be certified. You see, because once you are listing that entity as an approved provider, you are opening up yourself to a number of things. Because what you're saying to me as a client is, if you go to Jack, who is a traditional medicine specialist, you're cool, you're okay. So we have to ensure that those persons are certified, right? That they are operating at a level where they can withstand scrutiny.
Right.
And I think I mentioned yesterday that it is not because you're a doctor, whether it's a regular doctor or traditional doctor practicing traditional medicine, that you automatically can just say, hi, I'm interested in becoming part of the network. There will be very stringent investigations into every healthcare provider who will be added to.
Right.
So some of those persons who are currently providing service as private practitioners, if they have to join the network, they'll have to qualify. They have to meet the minimum standards, because there'll be standards set for providing care. So they have to qualify under the minimum standard to be certified. Because once, like I said, once NHI says, these are your list of approved, the word is approved providers, then it means that you're opening up yourself to all sorts of stuff as regards to malpractice and this sort of thing.
Yes.
So, you know, the entity has to be very careful.
And we need that in Grenada. We need somebody or a body that governs or guides the administration of healthcare by even private practitioners as well. And of course, it's going to mitigate the fact that I can go to my private practitioner and receive assistance, but then I still have to go to the government laboratory to receive a test. You know, and that's two different sets of monies being spent in two different areas. You know, so I guess it's going to mitigate that aspect of it, and it's a good thing. I like that NHI covers so many aspects of our healthcare. It's like a general fix-it, basically.
Yeah, it is. You see, it's the NHI is almost like a watchdog. Also, people say primary healthcare providers are the watchdogs of healthcare. But what NHI does is that it helps to set basic minimum standards of care. So in the past where a private practitioner could have gotten away
Right.
with certain actions. If the standard set on the NHI is that in addition to having your license renewed every year, you need to have a minimum of X amount for malpractice.
Right.
So if you're sued, if a patient sues you, you have medical insurance or medical malpractice insurance
Right.
that takes care
Of
of that suit. So,
Right.
I mean, we don't do much of that in Grenada. People
No.
don't go to court. We're not a litigious society. But you never know
Yeah.
who would decide, I need to take this matter further. I went
Yeah.
to this person and he prescribed or she prescribed this, and this is what happened to me.
Yeah.
I mean, there are cases where persons have been treated for certain illnesses that they never had, and it has side effects or backlash on their lives. So NHI is going to be setting minimum quality standards.
Wonderful.
So every person who considers themselves a provider, approved by, because again, I can be a medical doctor, but decide not to be part of NHI network.
Right.
I don't have to be if I'm a private practitioner. So it means anybody who goes to me pays out of the pocket.
Right.
But once I decide to come into that network, I have to meet certain minimum standards in order to be advertised as an approved provider.
Right.
Because it's very important. You see, NHI brings together a number of parties.
Mm.
There is the payer. There is the provider. Right? Now, it may not seem to us as if we're paying for NHI, depending on the route that's taken for contribution.
Right.
Right? So if, for example, it is taken out of my purchase, right? Every time I go to the shop to buy something or to the grocery, I pay for NHI. So
Right.
I'm not, it's not, it doesn't seem as though I'm paying a premium.
Right.
I'm, in essence, paying the premium, but it doesn't appear that way.
Right.
But then there's the provider, who is the medical doctor or the lab, or the medical technician. These are the providers, right?
Right.
So these two persons interface,
Mm.
right? Because without the payer, without the individual, the provider he doesn't have a service to provide, because if the person doesn't go,
Yeah.
he would not have a business. So there has to be a situation or a case where providers recognize that the level of service that they need to provide has to be at a particular standard.
Of course.
Because if right now I decide to go to a doctor, so I know Dr. X is charging $80 and Dr. Y is charging $100. So I'm going to Dr. X because I'm going to save $20.
Yeah.
So under NHI, whether X or Y, once they're part of the program, the client has a choice.
Right.
So those providers that don't meet or come up to the standard would find that they're in the offices and nobody's coming to them, because they're paid based on the persons that they see.
That they see.
That is one of the provider payment options.
And let me just pause you there for a moment. I know, because to some people, when you hear something like that, you're thinking, oh, well, now the government taking bread out of the practitioner's pocket. But that's not what it is. It's actually holding them accountable for the service that they provide. It's keeping them in check. And I like that. If we can have all of the practitioners in Grenada saying, yes, I agree with this, then it's going to make healthcare better for everybody.
What will happen, as has happened in almost every place that NHI was introduced? You'll have the early endorsers, those providers who come on early.
Right.
Right? There are others who feel, I have my private practice, I don't need NHI.
Mm-hmm.
Right? And they will not sign up, or they may not sign up in the early stages. But
Right.
guess what? When they see where the tide is flowing
They
and the
will.
offices are empty, then they would say, we're ready to sign up. You see, because I went to a provider. My wife had had an issue we had to deal with. And we waited for about an hour and a half to see that provider. There are a number of other people there. And I'm sitting there saying, okay, he's a specialist, and all of us are paying, right? So 10 persons waiting to see one doctor. We're paying. Just roll your mind out to NHI, where I'm contributing, right? So I don't have to have money in my pocket to go to see that specialist. That 10 persons would multiply to probably 100. Because the people who want to see this specialist and didn't have the monies before NHI has now access to that provider.
Right. And I know some people are thinking, because I mean it just crossed my mind as well in listening, that, well, the question is going to arise, well, doesn't that make the healthcare system now more congested? Because, you go to a private doctor with 10 people, it means you have less time to wait than when you go to the hospital and the physicians there have to see 30 and 40 people. But we also have to take into consideration that may well not even happen, because then there'll be a spread of physicians that are seeing patients, and these physicians will all be at the same standard because they are required to, in order to provide that kind of service.
The thing is, under NHI, you would only be able to access specialists when you're referred.
When you're referred.
Now, if I get up tomorrow morning and I have a problem in my ear, I may say, let me go and see the ENT specialist. That's me saying that.
Right.
Now, the NHI rules would be, you have to be referred.
Right.
So there will be a process to get to the specialist. Right now, again, whether or not you have NHI, you can decide, look, I'm not going to wait to see that specialist. I'm not going to go through this process. I have my money in my pocket. I'm going to see the specialist. So you can do that. So people still have access to the specialist directly.
Right.
But to use a specialist under NHI, you have to be referred.
Right.
Now, you would understand why this is the case. Because, I mean, if I have a pain on my chest and I say, boy, I think my heart bad, I want to go to the cardiologist.
Yeah.
I may not have to go to the cardiologist.
Yeah.
So it is designed that way to ensure that there's a flow. So all the preliminary, you don't waste the cardiologist's time to check to see whether you have a heart problem. If you go to the primary care system and you go to a general practitioner, he can diagnose and recommend, right, that I think you should go to see XYZ. Now, even in the UK, there is generally a clog in the specialist area.
Right.
There are long waiting times because of the number of specialists available.
Right.
What generally happens is that whereas a cardiologist, for example, may say, I'm not coming to work in Grenada because how many people would come to see me? How many people have money to come to see me? Now that NHI is around, he knows where the money is going to come from. So he would say, boy, let me set up shop here. Even the labs, I mean, there are a number of labs in Grenada. I mean, you'd be surprised at the number of labs that's around.
Right.
And more are being added because the investors have foresight.
Right.
In fact, I heard the gentleman who does dialysis was talking about the expansion of his services. And he said, I'm doing this to prepare for NHI.
Yeah.
Because I know when NHI comes, my clientele would increase.
Of course.
So the persons who have vision within the medical service can prepare themselves, because whereas before you were seeing in your lab 10 patients, because these are the 10 patients who have money. with the advent of NHI, that may well go to 100 patients. Are you prepared? So you see, it's not just the government side, and I was here some time ago and I spoke about health system strengthening, because you have to prepare the ground for NHI.
Right.
It is not the case of just say tomorrow NHI is available.
Yeah.
Because if you don't prepare the ground, it would be chaos. The infrastructure, the plant, all of those things have to be upgraded to a level to accommodate the obvious increase in the usage. There will be a dramatic increase in the usage of services.
Yeah.
Because whereas before, I'm not going to see the doctor because I don't have money
Can't
to pay.
afford it. Mm-hmm.
No, say what? I can go and see a primary care doctor at any time. I'm not feeling well.
Right.
So the ground has to be prepared. And it is not just the government that has to prepare, the private sector.
Yeah.
So there'll be engagements with the private sector. Government's the provider, then the private sector provider. There'll be engagements so that those providers would be aware
Right.
that there'll be a serious increase in the number of your clients.
Okay.
Are you making provisions for that?
Okay.
Because in the absence of that, we'll have situations where you may have a line from where Grentel used to be.
Mm-hmm.
You know that building?
Yeah.
To that place up on the Carriacou. I mean, people might be lining up there to get in there.
To get
No, you go in there, you maybe have to wait for a couple of minutes because there's one person
Yeah.
inside. But if they're the only ones who have these MRIs or the CT scans, and every doctor is going to go through the process of ensuring that the investigative services are done, and he recommends that Ms. Duncan should get a CT scan so I can see exactly what's wrong.
Yeah.
Just imagine what can happen. So there's the opportunity for investors in medicine.
Mm-hmm.
That's what NHI does. It creates opportunities, not just solves problems, medical problems, but creates opportunities, investment opportunities where people can get involved.
Mm-hmm.
Buy equipment.
Mm-hmm.
In fact, there are different ways that you can compensate providers, and that's a whole topic by itself. But one of the ways you can compensate a provider is by loading up front the cost of his machine. So if I want to open a clinic, for example, and I say to NHI, look, I want to bring in these machines.
Right.
It's going to cost me $1.5 million. I don't have the money up front, but we can work an arrangement whereby you meet some of the cost and you charge that against the service that I provide.
Right.
That's a way that the provider can be compensated. So there
great.
are different models that can be used for
Right.
compensating providers. But what we would expect is that NHI would change the landscape of health. I mean, it would be a radical change in the way things are done health-wise.
Mm-hmm. What I want to stray just a little bit, because I don't think that we understand that there are different levels of healthcare. There's primary, there's secondary, and there's tertiary.
Yeah.
Primary is already what we provide, because primary healthcare basically is like a gatekeeper, right? It's the focal point of medical consultation, basically. So most of us in Grenada utilize primary healthcare. It is for the uninsured and the underinsured.
Okay.
So I think we need to understand that. So primary healthcare is basically what we offer now, because it's more like the and correct me if I'm wrong, it is more like what we offer in the emergency room. Right, where you go and you get attended, and what tends to happen, because I did some research, and what I found is that the New England Health Institute, right, they did some research, and what they some studies, and what they came up with is that the demand for healthcare continues to grow all over the world. It's not just here. It increases day by day, because we have people that are growing older, we have people that are getting sicker every day. Most people don't focus on preventative healthcare. And preventative healthcare doesn't have to be coming from a government. I have people talking about the government needs to focus on preventative healthcare. You as an individual must be the first to focus on preventative healthcare, because it is your body, it's you, right? And what they realize is that as the demand increases, in order to meet that demand, because we have limited physicians to fill those spots, and that's not just in Grenada, that's everywhere. And in order to meet that demand, we have physicians, they're utilizing nurse practitioners and physician assistants to kind of fill those gaps. So what the NHI helps to do, because we already have the primary healthcare in Grenada, we already provide that. And what it aids to do is now bring us to a point where we can access secondary healthcare, where we can access specialists and be referred to specialists. And it also takes a lot of the burden off of these nurse practitioners and assistant practitioners or practitioners' assistants, where they now have less load on their shoulders, because nobody is underinsured anymore or uninsured. Everybody has access to some level of insurance where they have access to healthcare at every level. And that's what NHI really seeks to do. So I think we need to first understand that aspect of primary healthcare. We already have it. It's for the uninsured, it's for the underinsured. What NHI seeks to do is to take us a level above that to secondary healthcare, where we take the burden off the nurses, because everybody's crying out, oh, the nurses are overworked and they're underpaid and they're stressed. And that is not just here, it's everywhere you go. In fact, last night I was speaking to a nurse friend I had in the UK. She worked at the hospital here for a long time, and she migrated to the UK because she believed that the opportunity there was better. She was going to get more money and all of that. And I spoke to her, and in honest conversation, she said that it's nothing like Grenada. She said that the load is hard, is much more. The workload is much more than it is here. The demand for quality care is much more than here. Because you would go to the hospital and the nurses, I mean, by right, you are entitled to be frustrated, you are entitled to be upset, but you can't transfer that to the patient. And she's saying they can't even make that mistake, where she is. She says, while the money is good, the hours are so much longer. The hours are so much longer. The demand for better healthcare is more. And she's not even happy. She doesn't enjoy her job simply because she's not in a comfortable environment. While she loves what she does, the environment isn't comfortable. Because apart from the hospital, what else does she really have? What kind of... And that's what we need to focus on. So while primary healthcare here may not be the best that it can be, or as great as it can be, at the same time, we need to understand that it's not all that it's trumped up to be everywhere else.
You see, primary healthcare, and I have to be very careful what I say here. Primary healthcare is premised against provider's attitude. That's when you interface with a client in the early stages of his ailment.
Right.
And the way you treat with that patient can have some serious effects on how the patient views healthcare.
Right.
A specialist knows what's wrong with you. So you come to a specialist and he is going to treat that particular ailment that has been identified. Primary healthcare provider is trying to figure out what's really
what's wrong.
I mean, I don't know if you have... When I did life insurance, we had to study all illnesses. And the symptoms of an ailment can be similar to another one. The primary care provider have to determine, is it illness A or illness B?
Right.
And you hear people say, I went to the doctor and he gave me this thing to try. And he told me come back in 2 weeks or 3 weeks. And if that doesn't work, he'll give me something else to try. Now, that's when people try to diagnose. And again, I just want to say that whereas as it's practiced now, primary health care, it's more a touch and go sort of thing where with limited equipment in a primary healthcare provider's office, especially in a private office, they do a diagnosis based on the symptoms
of
that you have. It may or may not be the illness that they're treating you for. That's why you have to come back. And people say, well, I go to the doctor 2 and 3 times, and every time I go, he gives me a different medication. Because as far as they're concerned, because your illness could be A, B, C, or D, I'm going to guess which one. So I'm going to guess it's probably B, so I'm going to treat you for B.
Right.
Now, under an NHI system, you troubleshoot, and then you seek assistance with medical equipment. So there are tests that we can do to pinpoint whether or not it's this, that, or the other. And that's the advantage of this thing.
Right.
Because when you come to see a provider and you exhibit certain symptoms, he may decide, look, we have to do some investigative services to narrow down what's really wrong with you. So I'm going to send you to do X, Y, Z, right? Some of them still do it here. They send you to do a lab test, etc., and you have to come back so that they can narrow what you do. So primary health care, as you say, is really the gateway. That's when you can narrow down what you think that person is suffering from, and then treat that person accordingly.
Yeah, it's more symptomatic health care.
Exactly. So NHI is going to give that provider the freedom to find out exactly what's wrong with you. Not guess what's wrong with you, but to diagnose correctly, right?
Right.
And that's why we have this lab services, investigative services. Those things will be part of the program, right? It would not, well, again, there have to be guidelines as to how many times or how we could use it, because a doctor can send you for a CT scan if maybe you don't need it.
Right.
And in Grenada we have providers that do medical doctor is there, and they also do investigative services.
Right.
Right. There are some people who believe that maybe because he's offering or she's offering the service, she asked me to do it or he asked me to do it. The question is that a necessary intervention?
Right.
So what is going to happen is, as the data is collected on an NHI system, the trends would be looked at. So every provider would be analyzed.
Right.
And it would soon become clear whether or not some of the services that clients are prescribed have to be done, especially if it's done within his same operation.
Yes.
Now, it will be very, in some countries, you cannot be a medical doctor and run a lab.
Right.
How we treat with it in Grenada is going to be very interesting, because we have a number of places that does everything.
Right.
Right? You go in there and the doctor does the lab test, he does everything. Whether or not that will be allowed to continue is another matter. I mean, I can't rule on that, but if it's allowed to continue, it has to be very stringent.
Right.
Because remember, the doctor under NHI, when the provider sends in his claim to NHI, he's paid for the services that he provides.
Right.
So if I have a lab, and I don't want anybody to think that I'm saying it's going to happen. I'm just giving a scenario.
Example.
If I have a lab, I have my X-ray machine there, I have my CT scan. CT scan is too expensive for small people to have.
Right.
I have, other pieces of equipment I can use. So I do everything for you. And the bill goes to NHI, and NHI pays.
Yeah.
The claims department within NHI would have people who have medical knowledge, and they would be able to see whether or not that test that was prescribed was needed for the illness.
Right.
And can say to the provider, we're not paying for this. This person didn't have to get this. So
it's
going to be, I mean, the workings would be very similar to what an insurance company does. Because with private health insurance, people are covered for primary care, And insurance companies, and I can say that because I'm an insurer by profession, insurance companies are often exposed to pay. So if the client goes to the hospital, because the person has a private health insurance, the hospital is supposed to bill that insurance company.
Right.
But the system we have in Grenada does not allow for that.
Right.
So insurance companies are getting away with I'm using more advisably, in the sense that a number of services are being provided to their patients or to their clients,
Right.
and they're not paying for it.
Right.
You go to the hospital and you're admitted in a ward other than the private ward. When you leave, when you're discharged, do you get a bill? No. So the person has private insurance, he goes to the hospital, he spends 3 weeks, and he leaves. The insurance company, he's paying his premium every month.
Right.
The service that he's paying for is provided for him free of charge
Right.
under a system. So again, NHI is intended to correct all of that.
Okay.
As we speak, I know that the hospital is introducing a system where they can track patients in order to bill them,
Right.
right? Because people are not billed in the hospital. So I said it before and I'm saying it again. NHI is going to change the landscape of healthcare in Grenada. It's going to ensure that we don't have unnecessary expenses. It's going to cut back on wastage. It will cut back on wastage, because you then be able to track a number of things.
Right.
We have private persons bringing in medication
Right.
and selling in the pharmacy. So if you go there and it's $60, you pay $60. That's what the charge for the medication is. Now, if that person is part of the network, then NHI would be in discussion with those people and say, look, this is how much this thing costs under our formulary, because we have access to those drugs as a group. So I know you're the agent for whatever medication, but if you're going to be part of us and we can get this medication into the hands of our customers at $10, why would I pay you $20 for it?
Right.
So I mean, it is when you really think about it, it's going to be very interesting the way this thing pans out, because it would involve a lot of discussion. Persons would not agree, some would disagree, others would not like what's coming, because in their mind you're affecting the business. But I always say the needs of the many should always outweigh the needs of the few. So it is intended to ensure that Grenadians in generally benefit,
Right.
and not necessarily a few persons. So
Right.
we expect in engagement with providers, I'm talking about for medication also, there'll be a lot of discussions that will have to take place. So it's not a click of the finger. Some people figure, well, you guys should have done this thing a long time. And fortunately for me, like I said, I've been involved with it from the time it started. And I know it would not be a simple task to just get up tomorrow and say, let's do NHI. It is going to be, and even when you launch it, for example, in the BVI, they took about, I think it's close to 8 years before they launched NHI. And when they did, the registration of providers, they actually had to beg providers to register. A number of them did not want to be part of the program. I mean, the reasons were valid in that they were not consulted. And that's what we're trying to avoid in Grenada.
Right.
Consultation has to be wide, not only with the consumers, but also with the providers. And that is going to happen. But there was a guy said to me, Christmas Day, people were registering. They wanted to launch in January.
Right.
So engagements with stakeholders is key. it's a partnership between the providers of the service, the payer, and the clients. It has to be a all-round thing.
Well, that's great. And I know everybody's wondering about the cost and what is it going to cost us to contribute to the NHI. And I believe that that's something that is still up for conversation. It's nothing that has been. I've heard comments about, oh well, they don't decide what they're doing already.
Well, you see, when UWI did their work, UWI gave an indication as to how much it would cost to run what we want to run.
Mm-hmm.
And it ranges from like 196 million per year to a low of $187 million per year.
Right.
That's to provide all the benefits that I indicated here.
Right.
Right. As to how that will be paid for, one of the major contributors in any NHI is the government.
Mm-hmm.
So the government would have, in their budget, in fact, we made some recommendations that government increase their allocation to health in order to make up for that. So government will be a major contributor.
Right.
But because our countries in this part of the world are very, how should I put it? We don't have monies. We don't have gold. We don't have oil. We don't have resources to say the state would pay for everybody.
Right.
And that's why NHI has always promoted, and I'm talking about the National Health Insurance concept,
Right.
that the beneficiaries to the program can contribute
Right.
or should contribute. As to the model, as to how much they have to contribute, that's still been discussed. As I indicated, there are preferences. WHO, for example, warns governments that's thinking about NHI, warns them against doing payroll deductions.
Mm-hmm.
Now, that's the easiest thing to do. Do a tax, and once somebody's working, the money comes from there and it's sent to the NHI.
Right.
That's the easiest thing to do. But WHO warns against that.
Right.
One, it's not equitable in the sense that you have the burden of the program being carried by the established workers.
Right.
Right? So what is generally recommended is you find some consumption tax,
Right.
where persons who consume, everyone consumes, make a contribution
Right.
towards NHI. Right? I like to give the example of Ghana. Because when Ghana decided to do NHI, they had just done VAT. And they used the VAT model. They just called it a health levy.
Right.
So if your VAT is 20% and the NHI levy is 5%, I'm just calling numbers.
Right.
I don't want anybody to quote me on this. When you make a purchase, your consumption tax is now 25%. 5% goes to NHI, 20% goes to the government for other stuff.
Right.
Right? That is the most equitable, and that I've always promoted. I mean, I probably might be standing by myself on this, but I've always promoted that people should be allowed to contribute based on the consumption pattern. Again, what this does is that even the persons who do not want to work, right? Because once NHI is launched and a person is registered, whether or not they're contributing, they have access to the service.
Right.
In the BVI, where it is on a payroll, if the person is not contributing, you can track easily that this person is not contributing.
Right.
Apart from those wards of the states, those that the state pay for, then they don't have access to health care. No, there have been cases where somebody appears before a healthcare provider and doesn't have an NHI card. What do you do?
Yeah.
Right? So there are disadvantages to using a payroll. The advantage of the consumption one is that, like I said, everybody consumes. Everybody pays for
Yeah.
whatever they need, service or goods. So automatically they pay. It also gives the opportunity for visitors, persons who come to Grenada, because you see, I know there was a talk about putting a special tax on visitors, so that they would be able to access our health services. As to how that would work is left to be seen. But whoever is on the island or in the country, they can't eat their money.
Right.
They have to spend it, and a portion of what they spend can be allocated to. There have been questions regarding the whole issue of Grenadians who live abroad. I'm living in the United States, but I come to Grenada every year on vacation. How can I be part of the NHI?
Yeah.
Right? These are discussions that would be held, and the person can decide, I want to contribute. I want to find me an avenue to make a contribution while I'm away.
Yeah.
You know, the returning nationals, persons come back from the UK or the USA, they now come back to live. Now they would say to you, I probably have my health insurance from overseas. So if I have to go for a major issue, I'll go overseas. But while I'm here, I could get sick.
Yeah.
You know. Now, if you do a payroll, these persons will not be paying.
Will not be paying.
But they'll be accessing the services.
Yeah.
You cannot turn somebody back because they're not paying. You know. So
Right.
So as to how this thing will be financed, like I said, it's an ongoing discussion. But the government's contribution would be significant.
Of course.
Because apart from the wards of the state, the indigent, those persons who cannot afford,
Yeah.
and they may not be buying anything. They're probably in the care of other persons who are buying. You know, so government's input would take care of all those persons.
Right. Right. And I believe that we need to start having the conversation and coming to a realization that healthcare has to be paid for if we want the quality of healthcare that we are demanding, right? And it is our right to demand it. But we also have to realize that in a country like our own, where the healthcare system is not privatized, and the general resources that are pushed into the healthcare system comes from government revenue, then we need to understand that it has to be paid for in some way or the other. Because we could move around, government can move around revenue and say, okay, well, we're going to take from this sector and that sector and the other sector and put it all into healthcare to arrive at the healthcare that we want. But then you would find we'll find ourselves in a situation where other sectors begin to suffer as a result of that. And we don't want to pull from somewhere else to fix something, and then we have to go and put put more resources and more funding into something that could have been avoided altogether. So we definitely do want to pay attention to the conversations as it surrounds healthcare, as it surrounds the NHI, and for ourselves make a judgment not based on biased or policy, or politics or basic emotion. We want to make an informed decision on, is national healthcare something that I would say yes to or that I would support simply because I see the benefit. And as of this point, nobody has shown me a reason as to why this thing will not work.
You know, it's interesting that we had a caller last evening, or yesterday, who was promoting a new hospital. And I've heard it probably from since Sunday. I've heard it a few times.
Right.
You know, and it's kind of disappointing that we're not getting the persons who should be speaking on this speak and say not what is going to give them political mileage, but what's realistic.
What's realistic?
Because
yeah.
I would expect that you would say, well, government's initiative to do NHI is going to help to solve a lot of our health problems.
Yes.
Right? Now, everybody knows that.
Yeah.
In fact, everybody should know that. But
Yeah.
it seems that some people don't accept that.
Yeah.
So I would think that the better approach would be, let's get this NHI thing up and running as soon as possible, so that the average Grenadian can have quality health care.
Right.
We could take care of the plant later, not take care of the plant now. Because, I mean, I'm getting the impression that the advice that's been given is forget about NHI.
And build
Move towards building a new hospital. And to me, that is not forward thinking.
Of course not. But you see, in order to even get to the plant, you have to take care of the roots. You know, in order to get to the plant, you have to take care of the roots. If you don't take care of the roots, no, you can't put a new plant and expect it to live and prosper and produce.
But in everything, there's motive. I mean,
of course.
When we make this call for a new hospital, what's a motive? Are we making this call because we are so concerned about Grenadians' health? And how long would it take? So if government decides, look, I'm going to follow what you say, right? So we're going to put everything on hold and build a new hospital. In the meantime, what happens to our citizens? In the meantime, the same people are talking about the condition of the healthcare system. So, I mean, if the hospital is the priority, which to me seems to be what is being promoted, the priority for us in Grenada right now is a new hospital. So what about the other services? What about, so everything should be put on hold? I mean, anybody who's objective in their thinking would accept that the move towards an NHI system is the right one. And the records are very clear. The National Democratic Congress, when they were in office, engaged UE to do a study on the feasibility of a national health insurance program. It was done in that time.
Right.
And it was told to them, yes, Grenada is ripe for it. I read the report. There was no in this report that said, but do a hospital first.
Right.
That was not said in the report. Because everybody who follows healthcare knows that the plant, yes, is important, but giving people care, because you can start giving better care, quality care, without building a plant.
Of course.
You know, I'm kind of lost when I'm hearing this thing about build a new hospital, when the conversation should be around how soon can we get this NHI on the ground? What can we, whether you're opposition or independent, what can we do to ensure that this thing happens? What should be our input? Or, you know, are you engaging us? I would say, I probably would fault the government if I'm the opposition and say, but why are you not engaging us in the conversation?
Yeah.
No, you can make mileage with that. But when you go in on the opposite side, and talking about a plant, when the conversation is about healthcare and providing healthcare and finding a sustainable method of doing that, then you're all by yourself.
Because you see, what we fail to realize and what we need to do is start thinking critically. So, for example, in the current construct of the primary healthcare that we have, right? We have a lot of persons within Grenada, right, that are uninsured or underinsured. We access primary healthcare. We go to all of our to the ER when we're sick, and we sit there and we wait for a practitioner to come and attend to us and all of that. Now, if the conversation becomes, let's do a new hospital, how is that going to help with the lack of availability of the resources it needs to take care of even the people within the hospital? You know, how is it going to take care of the efficiency? How is it going to... All it's going to do is just put a new shine on the hospital, but the problems still remain.
But you see, this, again, those persons who are promoting this thing, if they are serious and honest with themselves, would know that the recommendation has always been upgrade your primary healthcare facilities. Yeah. Upgrade. So the medical centers, upgrade them. Even before, you see, the hospital is to provide secondary care. What's happening in Grenada is that everybody goes there,
right,
and a burden is placed on the hospital.
Yeah. If
you upgrade your primary care services, and that's what health system strengthening is intended to do, NHI is saying that we have to ensure that our individual health centers are equipped so that somebody doesn't have to travel from Sautez to St. George's to do a simple X-ray, right? There should be, and I mean, those of us who see what's happening in St. John, in Guelph, would know that the polyclinic is going to solve a lot of problems.
Yeah.
Because it's now a bridge between the hospital, person from St. Patrick, St. Mark, St. John. There would be a mini hospital in
Yeah.
St. John. I mean, it is, those persons who pass and look at it, it looks very impressive. It has to be equipped, but that is what the emphasis should be on.
Yeah.
I would say that those persons who are calling for a new hospital should be talking about upgrading our primary care services, upgrading our health centers. You
But of
bring it to the
course.
stage where you take the burden off
Of
the hospital.
course.
So you build a new hospital, and the same thing happens at 2 o'clock in the morning. Somebody goes to the ER. Whereas if you have a polyclinic, you have a upgraded medical center,
Yeah.
you can you take care of that problem over there. So if we deal with our primary health care in the right way,
Yeah.
there'll be less strain on the hospital.
Yes.
The hospital should be only for secondary services.
Secondary
Not for
services.
primary.
I agree.
Right? Outpatients, the health centers, they can take care, they can be equipped to take care of that. So when a
Yeah.
patient goes there, the hospital is the last resort.
Yeah.
If it cannot be cared for in that center, then he's sent to the hospital.
Yeah.
So the call for a new hospital, to me, it is it is one that is not, I don't think it's genuine. I think it's said, but it's not genuine, because those persons, if they have people among them who know about healthcare,
Yeah.
and that person, there's one individual in that group who speaks out about healthcare,
Mm-hmm.
and I'm hoping that you'll advise them that pushing this new hospital thing is not necessarily the best route to go. We should be
Yeah.
looking at upgrading our primary healthcare systems and move towards,
Yeah.
as I said yesterday, who knows? You may have a private investor coming to build a hospital.
And say they want to build a
You
hospital.
know, in fact, when I was in Colombia, there was a particular hospital who expressed interest in coming to the Caribbean. And of course, I plugged for Grenada, because he said, people come to Colombia, but there are other people who have issues with the language. It's not that the
Right.
doctors there don't speak English, but if we can have a place with the same quality as we have in Colombia, in the Caribbean, English-speaking Caribbean, we know we'll do good.
Yeah.
And again, we plugged for them to do that in Grenada. But we have to be, I think we need to be honest and genuine, because oftentimes we say and do things because it is politically expedient
Yeah.
and not being realistic. But people see through what we say and what we do.
But we as Grenadians need to ask the question. So you're saying let's have a new hospital. So let's do the math. Let's just sit here for a moment and do the math, because I don't like it. It burdens my heart when we are treated, and I say we meaning Grenadians in general, are treated as just political ploys. So I want to gain political mileage, so I'm going to bash the government in this area, and I know how Grenadians are, so they're going to respond, and we're going to get a little bit of mileage out of that. But at the end of the day, we know, and that's what hurts me the most. How can you sit and know and deliberately hurt Grenadians? You know you're doing something that is deliberately going to hurt Grenadians, and you feel comfortable just doing it anyway, because that will give you a little bit of power. It would give you a little bit of political mileage, and that is what hurts me the most about all of this. So let's do the math. So we have how many more years before a next election? About 3 more years. So let's put healthcare on the shelf, right? We're not going to talk about national health insurance, because we need a new hospital.
Mm-hmm.
Good. 3 years to an election. A hospital to the quality and standards that it needs to be will take about 3 to 4 years to build, right? Good. So we're talking about 7 years. 7 years where average Grenadians still do not have a means to access proper health care. How can you be a person that says, I want to represent Grenadians in government? I want to bring policies and procedures that will help Grenadians. And the topic that hurts Grenadians the most, or that Grenadians are most passionate about, which is healthcare, you are saying, don't do anything that's going to help them. No, let's build a new hospital that is probably going to take 7 years to build. 7 years. And let's shelf putting secondary healthcare in place. Let's shelf availability of healthcare to every Grenadian that needs it, even those who don't have somebody to say, well, you know what, I can pay for you to get this medication, I can pay for you to get that medication, I can pay for you to go and see a specialist because you have a skin condition or you have a bone condition. You know, how can we feel comfortable in ourselves to do something like that?
Well, I'm thinking and I'm hoping that the promoters of the new hospital would publicly state that their intention is not to put NHI on the back burner for a new hospital. I think they owe it to the Grenadian public, because I heard the new leader of the NDC speak about the new hospital. The gentleman who called yesterday spoke about it. Somebody else called and spoke about it. So we just need them to clarify that they did not mean that you should stop NHI for a new hospital. I think at least they owe it to the Grenadian public to say, look,
I agree.
When we talk about the hospital, we were not saying stop the NHI process.
Yeah. I agree.
And I think they would do it. I mean,
yeah.
let's give them credit for that. They would do it.
But more importantly, we don't want to hear we don't want to hear them say, because you see, it's a common practice that we condemn, but we don't commend. So we don't want them to just clarify that they didn't mean to stop NHI and build a new hospital. What we want is to find out from them what their views on NHI is, because we hear a lot, and I have a question here on the live that says, Mr. Roberts from the NDC is pushing universal healthcare for Grenada. Is that possible as we speak? And yesterday we would have had extensive conversation on the difference between NHI and universal healthcare. And NHI is the driving tool that gets us to universal healthcare. I
think Mr. Roberts should at least, I mean, and the person who posted this, they're the ones who raised it, yeah? I mean, but I think Mr. Roberts should, or he would, say to the Grenadian public that he's not saying forget NHI and do universal health. I think what he's saying is that, because I sat with him on a number of occasions. He was chairman of the National Health Insurance Advisory Committee for the first 5 years. He was chair.
Right.
He was also chairman of NIS. And the reason why he was put there is because he would have been in a position to galvanize the NHI movement. Nothing happened there. Happened there. The first movement on NHI was seen during the NDC when they did the feasibility study.
Right.
It wasn't done by when he was chairman of the advisory committee, not chairman of NIS. Right. He served as deputy chairman of the National Health Insurance Advisory Committee from, I think it was 2013, right? He served on that committee as deputy chairman. He eventually resigned because he was also pushing this, let's do universal health and, forget about the NHI. But those of us who study or read, and we're inviting the public to Google. I mean, Mr. Google is always there to see what's the difference between NHI and UHC, and they'll see it is a very thin line. There's very little difference between both.
Yeah.
It has become more of a concept, but one is the ultimate and one is the part 2. NHI is the part 2.
Right.
Universal health care. That's what it is. In some countries, they're used interchangeably.
Right.
So when he promotes universal health care, he's indirectly promoting national health insurance.
Right.
So I don't think the public should be led to believe that what Mr. Roberts is promoting is don't go the NHI route. Let's just forget NHI and do universal health.
And there isn't much difference.
What he's basically doing is, as an intellectual, he's letting us know that he knows about this ultimate.
Right.
But we are getting there. NHI is the part 2 universal health.
Yeah.
And like I said, do not take my word for it. Go to your computer, Google, see, you can type in UHC, Universal Healthcare, versus National Health Insurance, and read for yourself. So the next time he speaks, you'll be able to
understand.
say to yourself, well, I don't understand.
Because
what it's about.
when I first heard it, I thought that universal healthcare was something that was completely different and apart from national health insurance. Only to understand that NHI is a driving tool towards. I mean, everything is steps and processes. You can't just jump from one thing to another. You can't say that we need roads today and then jump to fixing the road tomorrow. Without there must be a process. There must be a plan. There must be consultation. There must be a needs assessment. All of these things need to happen before the implementation can even start. And it's sad that he will not sit and say, okay, well, national health insurance is good because it'll take care of XYZ PQRST, but he's jumping to the Z and saying we need to get to Z. So we are at B, but we need to get to Z. But how do we get to Z without going through all of the other letters?
I think the public, as we invited them to do their own research, would understand that the call for universal health is the same call for national health insurance. There's no difference.
But it's just
that one is ultimate.
Right.
That's where everybody's aiming to go. When you go to the Millennium Sustainable Goals, you will see universal health. It's not NHI, because NHI is generally a financing tool. That's where you utilize resources to get to where you want to get to.
Where you want to
so you would not see national health insurance from the United Nations. They would talk about universal health, right? But as we understand as lay people, NHI is the pathway to the road towards universal health. So we're going to get there, Mr. Roberts. We're going to get there. It's just that we want to do it in a way that is sustainable. You don't want to go and just say, let's do universal health insurance, universal health care, and just open up and declare that we're giving universal health care.
Yeah.
And then when people start, demanding the services that universal health care asks for, we can deliver it. So we're on our way. So the person who asked this question or made a comment, we are saying to them, read for yourself, and you'll notice, as some people say, 6 and half a dozen. So we're not promoting, we're not saying that we should not move towards universal health care, but what we're saying is that we're using the national health insurance as the part 2 universal health care.
Yeah. And that's important. I wish Mr. Roberts would come out and clarify and not just... So he's basically saying, yes, national health care is what we need, but agreeing with the government by disagreeing with them at the same time. And it's a little bit of politics, which is sad.
But like I said, Ms. Duncan, I had the opportunity to sit with Mr. Roberts, and he's my very good friend on the National Health Insurance Advisory Committee. And the discussion we're having here, we've had it there.
Right.
And we constantly have been saying, look, we cannot just go that route like this. There are implications.
Of course.
So we need to recognize that financially, we cannot just go universal health care.
Right. We
have to find ways to support. It has to be sustainable.
Right.
It has to be funded. How would it be funded? And that's why all these studies have been done. I mean, I was in a meeting where Mr. Roberts was basically questioning Professor Theodore out of the UE on the same matter. That's a gentleman who is one of the most versed persons in the Caribbean on UHC and NHI, and disagreeing with him on concepts. But again, as an academician, you can disagree on concepts, but in reality, we have to look at what's happening.
Yeah.
And in the 3 countries in the Caribbean that have attempted to realign the health system, BVI is NHI.
Right.
Turks and Caicos is NHI. Bahamas is NHI. Because they all recognize that this is the path that we need to take to have a sustainable program.
And when during this week we were talking about the government implementing policies and procedures that are sustainable, not throughout their lifetime, but throughout the lifetime of whichever government that comes into office. And what we tend to see happening is that a lot of condemning happens, a lot of no's and don't do's and you should, and then we don't see any reasoning as to why, or any plans being put forward as to how something else will work. So, for example, with universal health care, you're promoting it, yes, it's good. it's what we need. It's NHI is not it. We should get to universal healthcare. But then you need to tell us in longevity, sustainability. How do you plan to achieve that and ensure that after your government leaves office, or whichever government it may be, that it doesn't fall apart because it isn't sustainable, and then the other government gets blamed because you implemented something that was not properly done, and then it falls apart when another government comes in, and then you say, okay, well, that government didn't handle it properly, but you knew to begin with that it probably wasn't going to work in that sense.
Let me promise, I'll do some research. I'm not too sure if Mr. Roberts had presented a paper on this, but I'll check to see, because it may help to explain how it's going to be done. I know what we did on the National Health Insurance Advisory Committee is that we prepared a concept paper,
right?
A very comprehensive document that pointed where we wanted to go,
right?
And how we're going to get there, and that's why we eventually had to contract the WI to do the technical studies, which they did. They're almost complete now, because as I said last time, people have the impression, I get the impression that this government just jump up and say, let's do this. And that's why I mentioned that it started way back in 1995.
Right.
The National Democratic Congress did their part by bringing in the UE to do the study. That's documented. They also had the USA doing a hospital study. That was done. All these things, the documents are there to show that, there was a recognition that we need to be sure that this is what we want to do, and we need to see how it would look on paper.
Right.
So all of the studies were done. We're now moving to another stage.
Right.
Where we are preparing for implementation.
Right.
So we are now in what is called the pre-implementation stage, where all of the studies that were done, how do we gradinize it, if there's such a word? How do we make it fit in our local conditions?
Mesh it with our people.
Because you see, as I said before, I keep saying over and over, NHI is not a one-size-fits-all. Every country would have a different model.
Right.
It has to be designed for the people that live in your country.
Right.
So we are now at the stage where we have to look at what have been recommended, because they're all recommendations, and see how palatable, how possible it is to implement it on the ground.
Right. And one comment I have is, and it relates to a comment that we got on the live as well, because in a conversation with somebody I was having this morning, they mentioned that we Grenadians are after the fact people, meaning that we don't go to consultations, we don't attend meetings even if invited, we don't research, we don't do, some of us, because I research, but some of us, we don't do the necessary things that are necessary for us to understand what's happening. But then after the fact, we complain. And after the fact, we find all of the problems and all of the pinpoint all of the just the little bitty things to say that this wasn't done right and that wasn't done right, when we could have been part of the process to get it to where we needed to be.
Because Grenadians are so politically charged.
Yes, we are.
I don't consider myself somebody like that. I am an independent thinker. Right?
So am I.
So we look to hear what X, Y, or Z say before we say what we want to say. So we support a particular political party. What is that party's position on that matter?
Yeah.
And I'm going to just stick to it, whether it's right or it's wrong. And that's nonsense, in my view. Right? Whichever party it is. The party can have a position. If I'm part of the organization, I may not want to voice my opinion publicly. Right. To disagree with the party. But I have my private position on matters, right? But if the party that I support is pushing a line that common sense tells me, and it reminds me of Trump and the US, where those persons who are with him now would say yes to everything. He says once they step out, they disagree. I don't think you have to wait until you step out to disagree. If you don't agree, and you can give reasons why, you can help to shape what's going forward. And I don't expect Grenadians to just take the line, right? That a spokesman for the National Democratic Congress is saying, we should go the universal health way. So let's go that way. And that's why I invited them to do their research.
Yeah.
So you can say to them, say to whoever it is, look, what are you talking about? We ended up the same place.
Yeah.
What's the issue? What's the issue on the ground?
Yeah.
You know, the same with the hospital. What is the problem?
Yeah.
You know, why are you trying to, you know, cause people to digress, you know, to start thinking something else?
Yeah.
Healthcare is healthcare, and we need to do things. There are certain interventions that we need to make now to take care of the person who's going to be on weekend having a motorcade, right? To take care of that child that needs care, right? Or the mother who have to decide, what should I do with this $100 in my hand? Should I buy medication or should I send my children to school?
Yeah.
Right? These are the real issues that has to be dealt with.
Yeah.
And that's what NHI is going to help to solve those problems where people don't have to choose between health and survival.
Yeah.
Right?
And on that note, we are out of time. Mr. Philip, it is always a pleasure speaking with you on NHI. And of course, we have our weekend review tomorrow. Hoping to have you here to just break down all of the topics. And of course, we're going to open the phone lines from the very beginning so people can call in and just view their concerns, air their concerns, and their point of views on the national health insurance. But as we close here today, we want to remind all Grenadians, regardless of your political affiliation, regardless of who you support, regardless of which politician you like or you do not like, at the end of the day, it is Grenada that matters. It is the state that matters. It is every individual citizen, voice, those with voices, those that are voiceless. These people, we are who matter. Politicians come, politicians go. Parties come, parties go. But the policies that they implement benefit we, the people of Grenada. And we must seek the information, become educated, and become informed on the decisions that are being made on our behalf. And also be wary of propaganda and political mischievousness that seek to just hinder us from getting the real facts and getting the real information to make those informed decisions. So guys, in whatever you say and whatever you do, be safe, be secure. I want to be talking with you tomorrow and not about you. Enjoy the rest of your day.
The strength of the iron, it's in the testing. It's not a loss, it's just a lesson. Be grateful for your blessings. You'll be digging deep to find that inner strength. No, it's not the time to give up. No, nah. I'm telling you, nothing they do will never defeat me. We control your destiny. I'm telling you, take your hand and point it up in the ceiling for me. Please, I feel so irate. Wake up and I'm ready. Must make it ever steady. Setting goals is necessary while they idling. Precious time they waste.
Caribbean Marine Energy Technology Forum looks at cost reduction strategies for marine renewable energy. Details to this story and more in the National Report. With the details to the news for Wednesday, November 6th, I am Leslie Ann Johnson. Experts in technology exploration are meeting here over 2 days to advance their agenda and improve the environment for a cost reduction strategy for marine renewable energy. The Caribbean Marine Energy Technology, or CARIMET Forum, is looking at areas like the development and deployment of ocean thermal energy, including seawater air conditioning and kinetic marine energy, such as offshore wind, tidal, and wave. The focus will be on the establishment of practical research and innovation vision priorities for the next 5 to 10 years, which are supported by measures for coordinating activity across various governments, implementing agencies, funding institutions, and other key stakeholder interests. Dr. Devon Gardner, Program Manager for Energy at the CARICOM Secretariat, spoke to the readiness of CARICOM member states to embrace technology and move away from the traditional way of energy generation.
The bottom line is that marine renewable energy technologies have been advancing significantly, not as fast as, say, solar or wind technologies, but they have been advancing. And the expectation is that given the kind of focus that is now emerging in the blue economy, marine-based technologies for renewable energy are likely to start increasing in terms of their capabilities and their cost effectiveness even more over the next decade. So the bottom line is that externally there is going to be a significant push in terms of the technological options that are now available, and our countries have to be ready whether we want to or not.
Dr. Gardner says since 2013, CARICOM agreed on a common energy policy that speaks to implementation of renewable energy power.
And in fact, there were targets established for 28% of renewable energy production by 2022 and 47% of renewable energy production by 2027. It didn't specify what the source of the renewable energy should be in that power mix. Naturally, we have been looking since then at what the various options are for inclusion in that mix. Within the 2013 policy, it spoke to the exploration and where possible exploitation of marine renewable sources. And we believe that whilst we don't have quantifiable numbers, because we still are a long way yet in terms of determining the resources that are available, we haven't assessed the resources fully to know how much there is. There are already some opportunities to start to figure out what those resources look like and to figure out how the technologies will work.
Executive Director of the Caribbean Center for Renewable Energy and Energy Efficiency, Dr. Gary Jackson, says the energy environment is very complex and the vast majority of people across the region do not understand many of the issues that surround it.
And one of the things that the SCREE is trying to do is create an avenue for persons to understand the energy sector, even for the man on the streets. We want to educate the population so the critical mass can understand how to make the transformation. It's a big public awareness and education strategy that we're trying to develop, working alongside with the CARICOM Secretariat and all the other development partners and all the other institutions, the OECS Commission as well. What we understand is that the schools will need to make it a central part of their curriculum. We want to help them to how to navigate that so that the kids can understand what is the change to come. We have to depend on that generation to follow through, to do the transformation. We know we have created a damage on Mother Earth, and we understand that there's a climate action that is required. And what we're trying to do is create an enabling environment for the youngsters to move the transformation forward.
The two-day Marine Technology Forum at the Radisson Beach Resort is organized by the Caribbean Community Secretariat and co-hosted by the Government of Grenada and the Caribbean Center for Renewable Energy and Energy Efficiency. Small island developing states need to become more resilient in the face of the negative effects of climate change. That's according to the Honorable Gregory Bowen, Grenada's Minister for Infrastructure Development, Public Utilities, Energy, Transport and Implementation. He was addressing the official launch of CARICOM Energy Month during the opening of the Caribbean Marine Energy Technology Forum at the Radisson Beach Resort, under the theme Marine Energy at the Center, the Pursuit of Blue Economic Development within SIDS. Minister Bowen says the forum is both important and timely in facilitating the creation of ideas and cost reduction strategies for cutting-edge marine renewable energy technology.
The Caribbean region alone covers more than 1 million square miles in total area, and about 91% of this is ocean space. It is not surprising, therefore, that within the region there is an expanding demand for ocean-derived food, materials, energy, and knowledge. And this is driving rapid growth in the emerging blue economy.
Permanent Secretary with responsibility for public utilities and energy, Kim Frederick, reiterated the importance of the observance of Energy Month and the significance of the Caribbean Marine Energy Technology or CARIMET Forum. She says in 2016, Grenada, with the support of the Kingdom of the Netherlands, developed its Blue Growth Coastal Master Plan with a vision to optimize the coastal marine and ocean resources and to become a world leader and international prototype for blue growth and sustainability.
Among the ocean-related economic opportunities identified in the plan is marine energy exploitation, which includes the harnessing of renewable energy from the waves, wind, and sun, together with deep ocean water applications such as seawater air cooling, which I note are all to be addressed in this forum. Transitioning small island developing states' energy systems to sustainable and renewable sources and technologies is inextricably linked to their sustainable development.
This is the National Report. More news after the break.
Did you join the public service on or after February 22nd, 1985, and have since retired? This might be important to you. Government understands that the NIS pension may be insufficient to take care of your needs. So, while it awaits the court's ruling on the matter of pension for public officers, government has taken action to protect your quality of life so that you can take care of your needs in the meantime. Persons who joined the public service on or after February 22nd, 1985, and serve continuously in an established position for a minimum 26 years and 8 months, and retired at age 60, may be eligible to receive an advance payment, which when combined with NIS, represents 70% of their last salary. For more information, call or visit the Pension Secretariat in the Department of Public Administration, Ministerial Complex, 440-3767.
Continuing the news, 2 senior government ministers are among 200 delegates currently in Barbados participating in the 9th Caribbean Forum, co-organized by the Caribbean Development Bank, the Government of Barbados, and the International Monetary Fund. CARICOM Affairs Minister, the Honorable Oliver Joseph, is representing Prime Minister Dr. The Right Honorable Keith Mitchell and is accompanied by Minister for Climate Resilience, Senator Simon Steele. Minister Steele is a member of the panel which is discussing the topic working together toward a disaster resilience strategy, while Minister Joseph will participate in open discussions. Recent IMF analysis identified a 3-pillar strategy for building structural, financial, and post-disaster resilience, and Grenada is one of 2 countries that are piloting a disaster resilience strategy. The other is Dominica. A recent amendment to the fiscal responsibility legislation mandates that 40% of earnings from the Citizenship by Investment program be placed in a contingency fund as part of the disaster resilience strategy. The forum has brought together senior policymakers, public, private, and multilateral development partners to explore avenues for regional transformation to include sustainable and inclusive growth. Panel discussions focused on leveraging institutional arrangements to boost regional integration, countries and developing partners working together to build a structural, financial, and post-disaster resilience, and on taxation in the tourism sector, as well as developing an appropriate approach to tax incentives. A high-level panel also reflected on the challenges the Caribbean faces in a changing geopolitical environment. And that's the National Report. I'm Leslie Ann Johnson.